Okay. Feel free to pause at each question and read it on your own. And same goes for the answer slides. Feel free to pause those and think about them and proceed at your own pace as we go through this knowledge check section. But I am going to read everything in case you would like to listen. And I'm going to explain the answers just a little bit as well. So we'll get started with the knowledge check section. So here we're going to have a prompt, and the purpose is to get you thinking about sort of a practical example of a situation in which you're thinking about risk communication, and then to hear a question about what you should do in a particular situation. How would you handle it? And there will be several of these types of questions. So the organization you work for has been contacted by several families in the area who are concerned about the health impacts of poor air quality caused by pollution coming from a nearby industrial facility. They keep asking questions about what is in the air, if it is harmful, and how they can protect their families. The following 3 slides will present questions and answers. We'll go over each one, so please feel free to use the pause button and move through the section at your own pace. So your organization thinks it would be best to put some communications out for the community so that they can learn about air quality and have tools to protect themselves. Which of the following is not an acceptable next step? A, connecting with leaders in your organization and the community to learn about specific concerns and about any risk that is present. B, sending a social media message out from your organization that says, there has been an air pollution event, please be careful out there. Or C, scheduling a team meeting to talk about what types of communication materials might be best for reaching the members of the community. So the correct answer is B, sending a social media message out from your organization that says, there has been an air pollution event, please be careful out here. And again, this is correct because it is not an acceptable next step. The reason why this is not acceptable is because this next step, in choosing this next step, you would have not done any research about the event. You would not had any conversations with your team about it. And you're not providing any useful information to the community in this type of social media message. So it might be, a lot of times in the public health space or in community health work, or when we're communicating with people on a regular basis, and especially in the social media environment that we live in today, a lot of times it can be our first reaction to send out a social media message to let people know that we hear their concerns and everything. But when we're doing that, we have to be really mindful of the fact that we have to be providing people with accurate information, timely information, and evidence-based information, and information about how to do something about the risk that they're facing. So if we're going to send out a social media message and say, there's been an air pollution event, be careful out there, that doesn't tell anyone what the actual risk is. It doesn't tell them how to protect themselves. It doesn't tell them any information about timing or whether you're working on learning more. So really, answers A and C here, which were not the correct answers to this question, but those would be acceptable next steps. Connecting with leaders in your organization and in the community to learn about specific concerns about the risk that's present and also learning about the risk that's present. And scheduling a team meeting to talk about the types of communication materials that might be best for reaching the members of your specific community. So in this next question, you're in a team meeting with your manager who is in charge of outreach, and they suggest that it would be better to wait it out and see if things get better before starting to communicate with the community about this issue. So again, we're talking about some sort of air pollution event. Because you have some training in risk communication, they ask for your opinion. Which of the following responses seems ideal? A, that's a great idea. Waiting to see what happens makes sense because there might not even be a problem. B, I'm sure the mayor is aware of the issue, so it makes sense to wait since they will probably be taking some action. Or C, Thanks for asking me. I am concerned that this approach might leave people without information or comfort in a time of need. We should try to connect with the community on this issue as soon as possible. So the correct answer here is C. Thanks for asking me. I am concerned that this approach might leave people without information or comfort in a time of need. We should try to connect with the community on this issue as soon as possible. So this is really touching on that need to be early and timely in our communications and responsive as well. If we have people who are reaching out to us who are concerned about something and we are somehow involved with risk communication, in this case, we're obviously the person who our manager is going to for risk communication advice. It's important to establish connection with communities early about a potential risk so that you can start forming this dual two-sided conversation about risk that we talked about early on in the training, and start thinking about what types of materials you need to create to help people learn how to protect themselves, to learn more about the risk, and to hear about the concerns of the community. And if you're a trusted voice in the community and your organization is an organization that people look to for risk communication, or who look to help manage a situation if something arises, it's really not acceptable to wait and see what everybody else does, or to not put anything out. Even if it's getting in touch with community members who are concerned, or responding to people saying, we're aware of this situation, we're looking more into it to learn more and make sure that we can provide the best information possible about it for you. That's really important. Silence is really going to sort of damage trust that is built, and can potentially lead to a situation where people need information to protect themselves and they don't know who to go to because a trusted voice is absent.
I really like these two examples because it speaks to what you talked about earlier in terms of being strategic, working to, figure out the best approach to the issue. But in instances where if the organization doesn't know the right answer or have the right information, I like the idea that it's important to coordinate with trusted, entities like the health department or the CDC's website, to disseminate other information that's already been vetted and factual.
Right. And another thing is that hopefully these questions are showing, obviously these questions are not about interpersonal communication necessarily, but what they're also showing is that communicating about risks are something that can and probably should be integrated into how your organization or how community health work is done. Because, we come into contact with risks all the time, particularly right now in the context of COVID-19. People are always having to think about what to do to protect themselves, and making sure that, our trusted organizations in our communities, regardless of what type of organizations they are, and especially our community health workers, who are going to be people who you're going to be the trusted folks in the community as well, making sure that you are prepared to be able to talk with people within your organization and within your community about these risks.
Right.
All right. Our next question here is in response to calls from community members expressing concerns about poor air quality. You've been asked to design a flyer about air pollution and ways people can protect themselves. How might you get your flyer to community members? A, posting on social media. B, sharing it with community leaders and asking them to share it with others. C, working with community religious organizations to see if they will make the flyers available after religious services. D, creating a short radio message that you can send to the local station to let your community members know your organization can be a source of information for them. E, making the flyer available on your website. F, working with community businesses to disseminate the flyer. G, connecting with community groups to see if they will pass the flyer on to their members. Or F, all of the above. Oops, H, all the above. A little bit of a error there. The correct answer is H, all of the above. all of these things are important. And the thing that we're trying to communicate with this question here is that when you're trying to disseminate information, important information about how to protect yourself, it really needs to go out in a bunch of different ways through various entities within the community. Social media helps to make things easily accessible. Depending on what types of social media, it may only be for a particular group. Some people only really use TikTok, and the type of people who use Twitter are different than the type of people who use Facebook. So that's something that's really important to consider when you're designing social media messages. You don't want to just use social media, because then you might be leaving out people who don't have access to a computer or to a phone, such as elderly populations, for instance. And really, all of these things are pointing out that there are different aspects of how you get an information to people. Thinking about that channel piece of the equation, source, message, channel, receiver, thinking about the channel. All of these different ways are important for having sort of a cohesive strategy about making sure that everyone in your community has access to this important information. All right. And again, we welcome you to pause here and proceed through at your own pace through these. So feel free to do that if you would like. The next question is, you designed an awesome flyer on how to protect yourself from air pollution. You sent it out over social media and connected with community leaders and religious organizations to make sure that the flyer reached all demographics within your community. It seems like a lot of people in the community have seen it. True or false? This should be considered a successful risk communication campaign, and you don't have to worry about this becoming a concern again. People will be prepared for next time. The correct answer is B, false. So the reason why this is false is because this is going back to that sort of two-way communication and that process, that cycle that we talked about earlier in the training. And you can refer back a few slides to sort of remember that slide and to think about this conversation that happens. But risk communication is something that is a process, and it's evolving, and we talked about making things rememberable and having reminders. It is unlikely that you're going to have a risk scenario that's going to come up and then go away and never be a concern again. There are many cases and many situations where risks are sort of constant or chronic, or they may come up at different points in time. If we're thinking about air pollution, for example, there are different times of year and different times of the day where ozone may be something that's more of a concern for people who have asthma. So really thinking about those things and thinking about when your messaging should be put out is really important. And it's unlikely that you're going to put out one flyer and that's going to be sufficient for everyone to have seen it and to understand about the risk and not think about it again. You're probably going to want to have some other piece of this messaging campaign that comes up a little bit later to remind people about the risks. Or maybe you put it out a couple of different ways, and people have seen it, and then you want to do it again on a couple of other different ways. Like maybe you do social media because you know that people in your community are on Twitter. This is just like a random example. But then you want to make sure that next time you do it on the radio or you do those things together, and you have to do that again in 6 months, because in 6 months there's another air pollution event or whatever. The point is that it's important to be mindful that risks and the fears and the need for information on how to prepare or protect someone from a risk are usually not points in time. They're usually things that happen over time, and you should be prepared as someone who's doing risk communication to do that on some sort of regular basis in a way. Great risk communication is something that's built into the infrastructure of how we communicate and how we do public health. And those things require attention over time, connections with our communities over time. And another thing that could potentially happen is that there's a static risk, but people learn how to protect themselves over time. But maybe we learn something new about that risk And so it's still there, but it's changed a little bit and we need new information. So we really just need to make sure we're keeping an eye on this risk and we're keeping in touch with the community so that we can provide whatever information is necessary and we can make sure that people, are prepared in the future if something were to happen again, even if the risk goes away, like maybe the risk of ozone is low today, but it's going to be really hot next week and we're anticipating higher levels of ozone. We're going to have to remind people next week, hey, if you have respiratory condition like asthma, you might want to stay indoors on Friday, things like that. So this is just a reminder that you need to keep that sort of time frame in mind and that it's probably not going to be a situation where it's one and done and that's the end of the campaign.
Those were great examples and a nice segue for us to remember that with the pandemic, it is rapidly evolving, right? So how we respond now, different tomorrow or three months from now. So that's a nice segue into a different scenario that I want to walk you all through. So similar to how we just did the previous scenario, I'm going to read this scenario, and then on the next few slides, there are questions and answers that we'll go through. So again, feel free to go through this at your own pace. Pause the button if that's more effective for you. So here's the scenario. This is a fictitious organization that I made up. It's called the Health Justice Community Wellness Center. It's a nonprofit organization whose mission is to empower communities impacted by social and economic inequities. This organization is co-located on the south and west sides of Chicago in communities with high COVID-19 positivity rates. This organization employs local community members, and some of these folks have little to no experience, but part of their work is to get trained so they can provide the community with health and economic development education workshops, right? As far as the catchment area of who this organization serves, the community tends to view this organization as an important community resource during the pandemic. So they turn to them often, for up-to-date information about COVID and about the vaccine. However, the staff have little to no public health experience or knowledge about the pandemic. So that's the scenario. So here's the issue. The Health Justice Community Wellness Center is getting inundated with calls from community members who are frustrated about conflicting information in the media about recently released COVID data that's highlighting high positivity rates in their community. How should this organization respond? A, provide a link on their website directing the community to up-to-date information about COVID positivity rates in their community. B, listen to the community members' concerns to better understand their priority issues and develop messaging using factual, up-to-date information from credible sources to then disseminate to the public using their communication platforms like their website and social media. Or C, post a hotline phone number on the website for community members to call for more assistance. And the correct answer is B. Listen to the community members' concerns, better understand what are the issues that are important to them? What are the issues that are priority over all the issues that they, I'm sure, have to deal with? And then using that information, develop messages that are filled with factual information from credible sources, and then disseminate that information to them. And not only disseminate it just that way, but be mindful of what are some of the ways that you are able to reach the most people, have the greatest reach and impact. So this is just sort of another example of what we've impressed upon you previously. Work with your community and where they are. Work with them and meet them where they are. This next example, so the Health Justice Community Wellness Center, they've received some complaints about unanswered requests from community members for information about the COVID-19 vaccine. And as a leader in your organization, you notice that the staff are reluctant to address these concerns due to their own concerns about the vaccine. How should you address this issue? Organize an education session with medical experts and trusted community members to provide information about the difference between the vaccines, the side effects, and provide time to listen to their concerns and answer any questions. Or B, provide the training sessions on how to respond to the community's questions and concerns related to COVID-19 and the vaccine using effective communication strategies. C, disseminate fact sheets or newsletters on a regular basis to the staff with facts about the vaccine, about COVID-19, how the vaccine works, data such as positivity rates throughout the city, and tips on how to educate the community with links to resources for both themselves and the community. Or D, all of the above. And the correct answer for this one is D, all of the above. So this is one of those examples where, we don't want to assume that everyone feels the same way that we may feel about, for example, the uptake of the vaccine, right? There are some people who have some trust issues, or they're not there yet, and they may be in roles where they have to, educate the community on different topics, and the vaccine may be one of them. And so providing them with more education and giving them resources to learn more is the right thing to do. Using credible resources like medical experts or other trusted community members is also a good approach. But then also providing them with actual factual information through, newsletters. You can email these types of resources to them on a regular basis, or if you have like a bulletin board in your office space, you can make this information available to them in a variety of ways. But the key thing is training them through education sessions. I think we have one more example for this scenario. All right, so thinking about our organization, here's the scenario. Community members have expressed concern about whether to get the vaccine or not. Some people have said that they have no intention on getting the vaccine because they don't trust the government, or they feel that the scientists have developed the vaccine too quickly. And other people want to get the vaccine, but they're delaying getting it because they want to know more about the difference between all of the vaccines that are available and the side effects. So how should this organization address this issue? A, listen to the community with empathy and let them know that the decision to get the vaccine is their decision to make. B, acknowledge the historical trauma that has impacted communities of color, explain the benefits of getting vaccinated, and encourage people to get the vaccine because it is the right thing to do to end the pandemic. C, organize a virtual town hall meeting with an invited panel of medical experts and trusted community leaders to provide information about the different vaccines, side effects, and provide time to answer their questions. Record the meeting and post it on your website so people can access it at a later time. What do you think the correct answer is? The correct answer is organize a town hall meeting, right? So you have community members who are coming to your organization because they trust you as a resource for information right there in the community. And you have two different audiences. You have some people who have no intention on getting the vaccine, but then you have some who are interested, but they just need a little bit more information to make an informed decision. And so this is a way of creating a public event that everyone can attend, both those who, in both of the groups I just described, and they have access to medical experts and actual credible information through trusted, messengers. In real time, they can ask questions and have their answers provided to them right there on the spot. But the other benefit to this is that it it allows people to be able to access this information. For those who may not have been able to attend this virtual town hall because they're at work or they have families to take care of, this is still a way of providing the community with helpful educational information that is accessible to them at any time. And so they can use it for themselves, they can refer their families to them. So this is a good answer. But you know what? There are elements in A and B that are really important too. And I don't want to dismiss those completely, though part of the answer is right, part is wrong, right? I really want to emphasize like the importance of listening to the community with empathy. That is very important to, acknowledge how people feel and let them know that they're being heard. And then also acknowledging the historical trauma. I think that is very important too. That also has, a very important impact on people. But one of the reasons why B is incorrect is because, it's telling people, it's the right thing to do, and it's imposing our values on them. We want people to, to be able to relate to their own values and lean toward information that, aligns with them. But C is the correct answer because we're giving them access to factual information. All right, I hope that you enjoyed those examples that we just covered and that you found them to be useful. We're going to wrap up with a few key takeaways that basically summarizes what we just discussed today. So keep in mind that trust can't be communicated and trust isn't owned, but what we can do is we can demonstrate trust, right? Communication can build and it can break trust. So the way we do that is just make sure that we're providing, factual information and that we're transparent and that we're honest about what we know and what we don't know, and that we're consistent. So demonstrating trust is our goal. Making sure that we're delivering our message early and often by a trusted messenger. One of the key things too about risk communication is that, there's a need to relay important information in real time, for people to be able to make informed decisions around public health threats. So keep that in mind too, right? Trusted messenger. You may be the trusted messenger, or you may not be. And I think that is okay. Some people are really comfortable with, speaking in front of large groups of people or being the face of an organization, and some people are not. So, building on the strength of people is a good idea, and it's okay if that's not a role that you want to play. There are other ways that you can contribute to developing effective risk communication. It's also important to elevate the voices of community leaders that are trusted in various neighborhoods and communities and sources of information. Communities tend to know what's best for them, and we need to be mindful of elevating their voices in that space. That's really key too. And showing empathy. Empathy is really important to meeting people where they are and being able to deliver effective information to them that is going to be receptive and tailored for them, right? Especially during a pandemic. And then acknowledge uncertainty. There's a lot that's rapidly evolving during this pandemic, and we're continuously learning more and more. And so that makes for this dynamic environment. And so give yourself some grace, and for the people that you're communicating to. And then also follow through, be consistent, and remember, sometimes less is more. You don't have to be an expert.
So thank you all today for joining us for this training. We hope that it was a nice introduction to risk communication for you. Again, we want to emphasize that it was not comprehensive by any means, and there were a lot of points in the training where we talked about, there are more areas or more in-depth information that you can explore around a particular topic. So we invite you to revisit those, to sort of, remember what types of things we were talking about when we said you should explore them more. And we also have this additional resources page here, which was a great place for you. You can use the links here for more information for your own work or just for your own interest. We provide links to the Public Health Communications Collaborative, which is a partnership between several organizations that are focusing on developing public health oriented communications, a lot of them which fall into this risk communication, under this risk communication umbrella. There are vaccine communication tips at debeaumont.org, which is where we got some of those earlier examples of specific vaccine related messaging from. The Chicago Department of Public Health and the CDC also have communication toolkits and information about how to communicate about COVID specifically. UNICEF has some great messaging guidance as well. And then we also provide a link to a page that talks about, I think it's at Boston University, which talks about different types of behavior change theories and goes more in depth into each of those theories and provides additional resources for each of those theories so you can kind of dive into those deeper. When you're trying to construct a risk communication or thinking about what types of behaviors or attitudes you're trying to focus on when you're creating a communication or when you're talking with a community, for example, you really want to understand, as Dr. Floyd was talking about earlier in this training, how people process information, what types of things are important for behavior change and attitude change. And this site will be a good resource for you. And again, we'd like to invite you, if you have any follow-up questions, you can reach out to Dr. Floyd. Her email address is listed earlier on in the training. And thanks again for joining us today. We hope that this has been informative for you and that we could provide you some basic information on risk communication for community health workers.
Thank you.